This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us this morning on Columbus Concerns. We've been trying to keep you up to date as much as we can on the coronavirus every day here on the radio stations, but also using this, Columbus Concerns, to keep you up with the latest that's coming out of the state of Ohio and the officials as they give us an update. Now, we're going to tackle that on a couple of fronts today. First, we're going to hear from Governor DeWine and Dr. Amy Acton from the Health Department on where we stand medically. And then we're going to focus a little bit on the economy and where things stand for out-of-work Ohioans and businesses that have been shut down with the Lieutenant Governor, Jon Husted. So we're going to start off Columbus Concerns with a statement from Governor DeWine and Dr. Amy Acton from the Health Department.
So I wanted today just to bring everybody up to date on, again, trying to share with you the information we have as we have it. We're moving forward. I don't want anyone to be alarmed, but I also want everyone to understand what we face. Again, two things we have to do. We got to do them simultaneously. One is the social distancing. One is to slow this thing down. The other is to build up, and build up very, very, very quickly. We do not have a lot of time. As I said, the projection is we start really getting slammed in 2 weeks, but may not even hit the peak until mid-May. So our goal, what we want for every Ohioan, is that they be able to be cared for, no matter where they are, what county they live in, rural, urban, suburban, that there be a pathway for them if, in fact, they get sick. As Dr. Acton has said, most of us, we hope, who get this will stay at home, be able to be cared for. 20% or so of us will not be, and a certain percentage of those will end up in the ICU. The hospital stays are a lot longer than we're used to, and so that's another thing that's going to put immense pressure on our hospitals. So again, there are plans. We will share those plans in broad terms as we move forward. We certainly cannot do that today, but each region is working and has been working for this moment. And for this moment is we now move into really high gear. We put the accelerator down. We go as fast as we can. We're now into the building mode. We're now into execution and getting it done. We will also talk tomorrow about what some of the needs are in some of the other equipment, and we'll have the opportunity tomorrow to talk about that. Let me now turn to Dr. Acton, and she can fill you in on other details and give you, I'm sure, much more scientific and medical perspective on what we have in store for us in Ohio. Amy?
Thank you, Governor. Thank you. Good afternoon, everyone. It is very good to see you today. Honestly, I don't think I could do much better than the governor just described our situation to you, but I will take you through a little bit more about the data we have, a little more about our dashboard, which we'll pull up here, and give you a sense of what we have. So on our website, again, starting yesterday, we created sort of a new dashboard page. It's interactive. You can actually learn a lot about age ranges, demographics, which have remained fairly steady in that sense, also by county. But we do want to say today that we have cases as of today. We know this is a big underestimate because of our limited testing, but we have 1,137 cases today and hospitalizations of 276. I'm sad to say that we have 19 deaths here in Ohio to report to you. And their age range, on the deaths, I asked for an age range of that, and that is from 58 years of age to 93. It's important to say that we are very much in the heavy part of the storm and going into the eye of the storm. I've used the hurricane analogy, and we are definitely on the up ramp of our slope. This is a very pernicious disease, and I want you to take all the precautions we've given you seriously. Remember, coronavirus.ohio.gov, a great resource for you, not just to look at data, but to learn all the best things you can know about social distancing, about cleaning, and any number of circumstances. We keep updating that information for you. Even Senator Portman, appreciate what he shared, and especially appreciate what he and the other legislators are doing on our behalf. But as he said, that having that trusted data and trusted information is so important at a time like this. We'll go ahead and look at the next slide. Again, our age range stays from less than 1 year of age, an infant, to 96, with a median age right now of 52. We've tested over 20,000. Again, the tip of the iceberg. We are working tirelessly to ramp that up. As Senator Portman said, a lot of what we're going to do and know is going to come from that wider availability of testing, and we have a lot going on amongst my teams to take advantage of that when that is first available. Again, healthcare workers, very important, trying to keep them healthy for the surge to come. And we still see that of our cases, 16% of those are people who are on the front lines. And everything we are doing is to protect them. Next slide. Again, our pie graph is just staying very constant. The more data we get every day makes our analysis better, our models better, but we're staying very steady, even with this increase in cases of a good proportionate. It's ranged from the 20 to 25% requiring hospitalization, anywhere from 9 to 11% ending up in the ICU. That becomes very, very important for us. I do want to say for you at home, any one of us could end up needing these services. Certainly, we talk a lot about our highest risk populations. Those are folks with pre-existing conditions. We've known the elderly, but we're seeing increasingly a lot of morbidity. We talk a lot in my field about mortality, which is death. But there's a lot of morbidity with this disease. And people who are getting it, while most of us are riding it out at home, any one of us we don't know how our body might react to it. And that's why it's so important that we have the hospital capability for you if your condition worsens. Next slide. So this is another take on our curves and our graph, our epidemic curve. We're trying to put this on our website for you. Sometimes I know depending on your TV, it might look a little bit harder to see, but you can see a shadow. This is our unmitigated, meaning if we had done nothing, if we had not, as Ohio, taken such aggressive, decisive action, but we did, and we've made a difference. We've shifted over to the model we want to see, this less steep, further pushed out curve. And there's a shadow here. I don't know how well you can see it, but it shows that every move we have taken has moved the model. And we're really trying to slow this and steady it. On this y-axis of a curve, we have our cases per day. I know it startled people to say yesterday, and our modeling is now showing that at the peak of this curve, we're now projecting that we may have as many as 10,000 new cases a day. And that is the number. And as the governor just said, we've built up hospital capacity in this country. And I want to say to you, there is no healthcare system in the world that could take on this virus as it was built. You know, when we talk about the Cleveland Clinic or some of our great hospitals here in Ohio, these are international institutions. They're some of the best healthcare systems in the country. And in talking to the CEO today, we know that there's no system in the world that was pre-existingly built to withstand what is a once-in-a-100-year pandemic. You know, so this is, everything we're doing is to build out capacity now. If you draw that hospital line on here, and we'll eventually draw it when the numbers get a little more steady, you know, our hospital capacity pre-existing is at about a third of that. It would have been a third of this. It's about a third of this curve. So we have been working in our plans and all along, but we are really ramping up our build out now. And we'll be coming back to you with a plan and more of those details, as the governor mentioned. I have the honor as the lead agency in our emergency operating system in our center to be the incident commander. My job is one more of strategy and serving the governor and lieutenant governor and his team. I am so honored to be working alongside General Jon Harris. He's a wonderful colleague. He will be running the operations side of all of this, taking what we need and putting it into action and quick action. And you will see that happening all around the state. He and I have worked together in the past. We do medical operations together. We do weekends of free care where his troops in the Ohio National Guard, alongside my public health folks at the local level, will give free care over a long weekend. So I've worked with him before. I've had the great honor. He's wonderful to work beside, and I look forward to working with him in the days to come. I want you to know that everything you are doing, the governor said it's two sides of this. More than ever, folks, batten down the hatches, the staying at home. Everything we do individually pushes this a little more and a little flatter. And that will make the most of our healthcare facilities that we're building. In the peak of this, when you talk about 6,000 to 10,000 cases a day as we go up that curve to the peak, you could fill the ICUs in 3 days. You could fill hospitals in a week. And so what we are building out is that capacity, but everything you do makes that need a little less sharp. And it really has made a difference. We have bought time in Ohio, and that is allowing these amazing hospital systems all over our state to gear up. We bought that time. We have to keep buying that time. So don't lighten up on this. Go into it more. Talk to your friends and family. You're watching this. We know that not everyone in Ohio is seeing these numbers or watching it. We need to spread the word. And that's where I need you to don your cape right now to help educate people, to tell more people about this that maybe don't have the opportunity to hear us at 2 p.m. every day. I want to say to you that we are determined. We are determined. The healthcare systems are determined. General Harris is determined, more determined than ever, and I need you to be determined.
Now we're going to focus a little bit on the economy here in Ohio as we hear from the Lieutenant Governor, Jon Husted.
One of the things that I know when you hear that is part of a health crisis that we're experiencing, that there's also not only health anxiety, but a lot of economic anxiety. And I know that what the federal government just passed, that Senator Portman talked about, gives us the resources to help get through, weather that storm, so to speak, the economic storm that we're all facing. And I want to first talk about the anxiety that maybe people who are unemployed or 1099 workforce, the anxiety that you're experiencing. You should know that we have not yet received the guidance from the federal government about how 1099 or independently employed people are supposed to go about applying for these benefits. But that hasn't stopped us. We're Director Kim Hall from ODJFS. We have already engaged the private sector, some tech companies that we have built relationships through our Innovate Ohio team to engage in preparing to build that system so that you can get access to those resources as soon as possible. That is underway. You should know, just like we're building out the hospital system, we're trying to build the tech system to allow you to get access to these services. For those of you who are under the traditional unemployment system, we know that because of the volume, it hasn't gone as fast as some of you had wished, and I had wished, frankly, any of us. I want you to know you're not going to miss the opportunity to apply. If you're worried about that, know that it will be backdated, and it will be backdated to the point that you're eligible. You will get your benefits. Just know that service is there for you, and we will make sure that you get served. A lot of times you're getting messages about having to meet those deadlines. You do not have to meet them. Apply when you can get into the system. I've been informed today that it's running pretty efficiently, although we know that depending on where you live and what your internet service, the internet service quality you have maybe at your home, you'll get a little bit different experience. And also, some of you, after you apply, you may see that you'll get a banner message that says you have to apply for work to maintain these benefits. You do not need to do that. Those waivers have already been granted to us. And you may also, I talked to the tech people about this, you may see the spinning circle that shows that it's processing. Please resist the temptation to keep clicking to re-enter, because in a tech sense, you're sending yourself back to the end of the line when you do that. And so don't do that. That overloads the system, and it'll probably be slower for you when you go about that. Businesses, for small businesses, Senator Portman outlined what the federal government is doing. We will post all of that and the access to that as soon as it's made available from us, from the federal government, at coronavirus.ohio.gov/business help. The federal package, as soon as that is available and those details available, we will get it placed there. But we also know this, that federal assistance for businesses probably won't be enough for some of you. There are still just elements of what the business world is like during a terrible catastrophe like the one we're experiencing that still need to be figured out. We know that through the Federal Housing Financing Authority that we have set up there, a 60-day moratorium on foreclosures and a 12-month forbearance, but we also have commercial real estate issues. I was talking this morning with a bank CEO. Many of the banks in the state have already taken these steps to avoid those problems. What they have done, and we're encouraging people to do this all across the commercial lending world, they've extended a 90-day forbearance, actually a deferral is a better way to describe it, and then added that on to the end of the particular loan agreement. Many banks in Ohio have done this, and that includes principal and interest at that, and that will help businesses maintain their cash flow. So if everybody does this, if banks and loan servicers put that 90-day deferral out there, what will happen is then the commercial realtors or real estate operations then don't feel the pressure to have to pay the banks. Then they can extend that grace to the businesses who are leaseholders or who have obligations to them, and that through the system will maintain cash flow for everybody, so that not only they can keep their employees on the payroll, but also they'll be able to come out of this, because they're going to need cash to come out of this at the end. And if everybody through that system does it, we will come out of this much better than we would otherwise. And Governor DeWine and I were talking about this morning. We believe that the private sector can best handle this. Most of them are doing it. We encourage all of them to do it, because that will get worked out much better than if we have to pass some sort of government mandate to do it, which we're willing to consider. All of us will be better if we come out of this collaboratively. I also want to remind folks that the bill that the governor just signed establishes a vote count day for April the 28th. And so if you would like to cast an absentee ballot, you can do that at voteohio.gov. You can request an absentee ballot through voteohio.gov. If you do not have the capacity to print that out or get an absentee ballot application, you can call your local Board of Elections and get that so that you're able to vote. Also, while you're at it, remember we have a census. You can fill out your census. Ohio is going to need everybody to do that. That's important for our state. Governor and I have also had in the last 24 hours some great conversations with the county commissioners. We have ongoing conversations with the mayors and police chiefs. We thank you for all of what you're doing. I got a message today, a couple messages from Mayor Whaley in Dayton and Mayor Ginther of Columbus. They are working to enforce the stay-at-home order in a common sense way to make sure that businesses are doing what they need to do to keep a sanitary workplace for their employees. They're out there enforcing it. They're trying to use common sense. We ask you to use common sense.
An update on the coronavirus epidemic here in Ohio, starting off with Governor DeWine and Dr. Amy Acton from the Health Department, and finishing up talking about the economy with Lieutenant Governor Jon Husted. Thanks for joining us.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.